The name of the program is Cancer Prevention and Wellness, so really anything that we can do for risk reduction to prevent cancer from occurring in the future.
We know in cancer in general, you win when you detect cancer early, because early detection means less aggressive treatment and better survival.
What's unique about this program is that it's really looking at personalized prevention, looking at somebody's genetics and their family history and their environment, and really trying to prevent cancer from happening in the first place.
Trying to capture those patients who are high risk, trying to identify them, and trying to tailor their care from that point on.
The fear of cancer is visceral, and so if we can do something ahead of time to allay their fears, as well as thinking of mechanisms where we can have an impact on their lives, that would be great.
So in oncology, we have been utilizing personalized medicine for several years now, looking at people's tumors and giving them treatments targeted.
We are diagnosing cancer at earlier stages, and a lot of this is done by screening programs, enhanced screening, genetic testing that identifies people at higher risks. I do think education is a huge mainstay of our program, and one of the things that we really do is a lot of outreach to reach some of these communities that may not be plugged into the healthcare system, honing in on some of those lifestyle modifications and things that people can do, not just to reduce their risk of cancer, but to improve their overall well-being. Really empowering people to know what they can do to reduce their risk, and then also taking the time to sit down with them and look at their individualized risk with some of the tools that we have.
84 people in Wisconsin are diagnosed with cancer every day. This prevention and wellness program can eliminate almost 50% of those new diagnoses. Think about the impact these programs can have.
I was one of 84. So in the state of Wisconsin, 84 people are diagnosed with cancer every single day. And that day that I was diagnosed, I was one of those people. I was pregnant with my third baby. You know, I had a 2-year-old and a 4-year-old at home, and I just wasn't feeling well with that pregnancy and was short of breath. And so I went and saw Dr. Batista at the time, and he did an ultrasound in clinic, and he made me go have a CT scan immediately that same day. And then he called me on my way home from that scan and told me that I had cancer.
We were not ready for it. We didn't think that that was even a possibility.
First of all, what in the world was I going to do? I was pregnant. How was my baby going to survive? Of course, you go right away and think like, I'm not going to survive, I'm going to die. And that's terrifying, completely terrifying.
The doctors were great, telling us, okay, here's the options.
I had chemo while pregnant, was induced at 36 weeks, and then continued on chemo right after. My husband was a rock star through all of it. He was still working and coming home and doing all the house stuff and just manning the fort. He got up every night with the baby. It just definitely opened my eyes to a totally different side of things, being a patient. So I never would have thought I would have been a cancer care nurse. I never would have thought I was going to be in a clinic. I was a die-hard ICU nurse forever. I did feel that I had a lot to offer to patients. There's value to sharing your story, and if my story can help strengthen someone's faith, I think that's huge. If we can prevent or catch cancers at a very early stage and prevent having to have patients have to go through chemotherapy or any major surgery or radiation or treatments, I think that would be a fantastic, it would be life-changing and literally life-changing for people.
This program has the potential to impact basically everybody because, cancer doesn't discriminate, as we know.
I want to be part of the hope, the message, the ability to at least, help patients that are going through this.
These prevention programs actually give hope to patients and their families.
Proactive.
Proactive.
Hope.
Hope.
Innovation.
Preventive.
Empowered.
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 Empowered.